Hey there, welcome to the webinar. I'm so glad that you requested this. I'm assuming that you might be having back pain or sciatica, or you have questions about back pain and sciatica. Hopefully, we will get all your questions answered over the next 40 minutes. But if not, feel free to call us with any additional questions that you have. We can be reached at 603-380-7902, or you can email us at info@cjphysicaltherapy.com. But what we're going to go over in a few minutes is basically why so many people suffer from back pain, 4 out of 5 people to be exact. And we're going to go over a lot of myths and misconceptions about why people really get back pain, what actually causes it, and how you can fix it. Most importantly, how you can fix your problems from home without things like pills, procedures, or surgery. There's a lot of ways. A lot of people think that there's no hope, even if you've tried regular physical therapy or chiropractic or massage, acupuncture. People think that if you've tried all those things, that there's no other option except maybe surgery or a procedure, but it's actually not true. We've been able to help hundreds of people in our practice, just like you, who've been dealing with these problems, not getting the results they're looking for, and then we're able to still help them. And a lot of times it just comes down to understanding what the real cause of your particular back problem is. It's not the same for everybody. That's what we find is a missing piece for a lot of people. So I hope that you learn a lot. I'd love to hear your takeaways. Feel free to email us, info@cjphysicaltherapy.com. And like I said, if you have any additional questions and you need some additional help, we're free to hop on the phone with you anytime and answer your questions. So enjoy. All right, so as I mentioned, we're going to be talking about back pain and sciatica. This will probably be together for the next half hour, 40 minutes or so. So get comfy, but comfy and good posture, of course. But this is part of our health and posture series. We typically do this around 3 to 4 times a year. We usually rotate the topics. This is always our most popular topic because back pain and sciatica is a big deal. It affects about 4 out of 5 people end up with really debilitating back pain at some point in their lives. So this is always our most popular one. Normally we do it here in-house, but obviously we can't do that right now. So we were able to kind of switch it to this. So that's pretty cool. So welcome everybody. We're so glad you're here. Like I mentioned, we're gonna talk a lot about what causes back problems. And then, some of you are gonna get what you need from this presentation, and you're gonna get some really great tips and tricks that might be enough to help you with any of the problems that you're having right now. But some of you might need a little more help. So if that's you, definitely Michelle is gonna be posting in the chat along the way ways to get in touch with us. She'll put our phone and our email there. But if at any moment you want her to just like call you and get in touch with you, just type, yes in the chat or call me in the chat and she'll get in touch with you guys. But we'll talk more about that at the end. But Dr. Jessie and myself are opening up extra spots right now because we've been getting a lot more phone calls. People are just sitting at home, their backs are getting worse. So we know that even though we are actually still open right now, if you want to come in person, we can see you. We're considered essential healthcare providers, which is a good thing. But about half of our clients don't feel comfortable leaving. So we're doing stuff like this. Just like I'm talking to you right now, we're able to help people from home. So Michelle's there this whole time to help you guys if you need some help right now and you want to get on our schedules tomorrow. But now this is what we're going to talk about today. So basically, quick overview. We're going to talk about why back pain is such a big problem. Like I said, 4 out of 5 people suffer from debilitating back episodes at any point. And it keeps them out of work, and it's a real problem, and it leads to unnecessary procedures and surgeries that we're going to talk about a lot too. A lot of myths and misconceptions about what really causes back pain and what the right advice and what you can do about it. Like I mentioned, we're back pain specialists here. We help a lot of people who've tried a lot of other things. People have been to regular physical therapy. People have tried chiropractic, acupuncture, things like that. Some of you on this webinar we've already helped, which is awesome. But we're going to go over some of the myths and misconceptions, and then we're definitely going to talk about sources of back pain, like where does it come from? Is it from your disc? Is it from your muscles? Is it from arthritis? Things like that. And then most importantly, what you can do about it. So by the end of all this, you should be able to walk away with this information. So real quick, who are we? Why the heck should you listen to us? So I'm Dr. Carrie. I own CJ Physical Therapy and Pilates, and I'm a back pain specialist. I also specialize in Pilates. and I've been doing this a long time. I've helped hundreds of people with back problems, and lots of people who thought they really couldn't be helped anymore. And we work with a lot of folks who have tried a lot of other things. They've kind of been said, okay, well, you have to either live with this, or you need surgery, or you need an injection, and people just don't want to do those things sometimes. And they come to us, and luckily, because of the way we treat people, it's a little bit different than a lot of other places. We're able to help people. And Dr. Jessie here is our other spine specialist. I'll let her introduce herself and tell you a little bit about what she does.
Hi, everyone. I am so happy to be here. I have been a PT for about 4 years, and I specialize mostly in treating a variety of orthopedic conditions and just trying to help people stay active. My favorite thing about being a PT is just being able to help people get back to the things that they didn't think they would be able to do anymore. It's an amazing field, and I just love it. So you guys are going to learn a lot tonight. And if you have questions, like Carrie said, feel free. I'm happy to answer anything.
All right. Thank you, Dr. Jessie. We're lucky to have her. She's awesome. Patients love her, and it's been great. But Dr. Jessie and myself have been the only ones coming into our office right now. Michelle has been working diligently from home and doing an amazing job also. So I couldn't do anything I do without my team. So I'm glad they're here tonight too. All right, so what do we do exactly? So Dr. Jessie and I together, and the whole Pilates team really, we help empower people through movement. So I mentioned we don't like to help people. We want you to not need to rely on pills, procedures, or surgery. Our medicine is movement. And we're going to talk a little bit more about that, because a lot of people get confused. Everyone kind of knows they need to move, they need to exercise, they need to move their bodies. Where the problem comes in, and where we really come in and fill that gap, is which movement should you be doing? Not if you're in pain, back pain, knee pain, hip pain, whatever. If you're having pain and the pain is impacting your ability to do things you love to do, you can't just do generalized movement. You need to do specific things. So that's where we come in. We help empower you through specific corrective movements. That's our prescription. The nice thing about that is you can use it for life. You don't have to get it refilled, and you can't overdose on it. So that's the best part about that. I mentioned our particular practice tends to focus on people age 40 and up. The majority of our clients are in their 50s and 60s because they want to not lose mobility. They want to stay active. They want to stay independent. So we love that. And our focus is getting you to be able to spend the time doing things that you love instead of having to sit in the doctor's office all the time. So now into the presentation. So what really causes back pain? So, it wouldn't be so simple if it was just one thing. There's lots of things that contribute to it. What we're going to really talk about, we're going to definitely get into some of the things that the scary terms, if you will, that show up on MRIs, such as stenosis, arthritis, bulging discs, herniated discs, pinched nerves, things like that. Those things definitely cause problems, but they're not the only thing, and they tend to get overblamed for a lot of stuff. What we're going to focus a lot on is some of the everyday stuff, like your lifestyle, posture, inactivity, different things that you do every single day that actually contribute to those other things. And all together is what really causes problem. You can't fix one without the other, and that's a big missing piece in the typical course of back pain treatment. So we're going to talk a lot about that, and that is why so many people suffer from it and don't get better, because the true full cause is not understood, it's not addressed, it's not figured out, and that's what we're going to talk a lot about today. So the other thing is sciatica. So we've got back pain, we've got sciatica. Some people use the term interchangeably, but they're a little bit different. So typically when we think of back pain, we're talking about that kind of generalized across your back kind of feeling. Maybe it goes into your butt a little bit. But then some people get what's called sciatica, which is when the pain starts to go down into your thigh or into your leg. And that's a little bit different. And then usually by the time that's happened, it means that, the nerve has gotten involved. Your nerve is getting pinched. Your nerve is getting irritated. So we'll talk a little bit about the differences there and what causes each one. But the good news is there's hope for all of it. It all can be fixed, and it all can be helped without pills or procedures or surgery. And when I say procedures, I'm talking things like steroid injections and stuff like that. So symptoms of back pain and sciatica. So you can get, with all of these problems, you can get things like irritated nerves, you get decreased mobility, You can have weakness. So sometimes when the nerves are irritated and especially over time, you'll get generalized weakness, whether that's from an actual pinched nerve that is pinching the signal that the nerve is able to get to your leg, or sometimes you can get what we call weakness from pain inhibition. Your muscles just don't want to fire because it hurts. So you'll get things like that. And then you can definitely get numbness and tingling. All those things are typical, normal signs of back pain and sciatica. And none of these things mean you have to go get an intervention. A lot of people really freak out about the numbness and tingling, and they get really, really worried that it's a real serious problem, and not necessarily. It's very common, and you can get any one of these things. Oops, sorry, I do this sometimes. Any one of these things with typical back pain and sciatica, and we've been able to help people with all of these problems. So some statistics and facts. So basically, back pain's a big problem. Our healthcare system spends about $50 billion a year on low back pain. That's a problem, and it doesn't need to be that way. Most cases of back pain, though, are what we call mechanical, and this is where the confusion happens, and this is what we're really focusing on today. When I say mechanical, that means it's not caused by anything serious, such as like you broke your bone, or you have something like cancer, or you've got a serious inflammatory arthritis type of thing. Those things are a little bit different. Those don't fall into the mechanical category, but you can have mechanical components that influence them as well. So when we say mechanical pain, it has to do with joints, how things are moving, whether they're moving fully and freely, or if they're moving the way they're supposed to. And it has a lot to do with kind of your everyday lifestyle type of activities and decisions. So we're going to talk a lot about that. Some more stats. 31 million Americans have back pain at any given time, and it causes a lot of problems. One half of all Americans admit to having back symptoms at least once each year. It's the second most common reason for visits to the doctor's office. And then, like I've been saying more than once, 4 out of 5 people are going to have a debilitating back episode at some point in their lives. And it doesn't have to be that much. And sadly, I think it's going to get higher with just everyone being home, and not just being home, but a lot of increased stress right now. And those things play into each other quite a bit. So we want to try to, this presentation couldn't be happening at, a better time, because I think people really need to hear this information now more than ever, because so much of what we do is stuff that you can do on your own, which means you can do this on your own at home as well. So that's the really good thing. All right, so we're going to get into anatomy a little bit. We're not just going to kind of go over this briefly. We don't want to overwhelm you with this kind of stuff, but Dr. Jesse is going to jump in here and talk to us a little bit about some of the structures, because it's important to kind of understand how all of this plays in a little bit. So Dr. Jesse, go ahead, and she can start teaching you guys about the anatomy.
Okay, sure. So sometimes it's helpful to just have a sense of what these things are. You may be hearing something from the doctor's office, or you might hear something from us, and it's nice to kind of have a reference. So in the picture on the left, and Carrie might use her cursor and kind of help me point things out. So the picture on the left shows the spine in its entirety. So the upper part of the spine is called the cervical spine. That's the neck. The thoracic spine is the upper back. The lumbar spine is the lower back, and it sort of ties very nicely in with the sacrum, which we also kind of know as the tailbone. Now, the spine is curved in such a way so that it can kind of absorb shock. And, we have evolved such that we are upright. So it helps to sort of displace those forces and keep you upright. It also has these little discs in it, which help further absorb shock. So Carrie's showing the disc on that picture to the right. The disc is, you can kind of liken it to like a jelly donut.
Sorry.
That's okay.
Sorry, one second. It likes to do this. This mouse is very quick on the touch.
So the disc is like a jelly donut, right? The outside are these fibers that sort of run around. They all kind of they're interwoven, they go in different directions, and that makes them very stable and secure, which is great. And then inside you have this kind of gelatinous, like jelly type material. And that is really what helps us to kind of absorb shock and gives us that like fluid lubrication in the spine, which is great. But what can happen over time, and Carrie's going to allude to this, is that this area can definitely start to kind of have some age-related changes. If she moves forward a little bit, you can see, so basically we're looking at a top-down view of one vertebrae or one bone. So it's kind of like a cross section. So you can see the spinal cord in the middle. which she'll point to, perfect. And then you have the nerves that come out to the side. So when Carrie was talking about the difference between low back pain and sciatica, sciatica often does refer to irritation of that nerve as it comes out. And then often you'll get pain that goes along the whole course of the nerve. And that's the reason why it's a sciatica pain versus just a localized low back pain. And then Carrie, you can go to the next slide. Perfect. So this slide just shows you some of the supporting structures. So on the left, you have ligaments, which we don't talk about as much and most people aren't as familiar with in the back. But if you think of like spraining your ankle, in your ankle, you're spraining a ligament. So a ligament is a structure that connects bone to bone. So it's kind of like a connective tissue. And there's a lot of those in the spine that help to limit different motions of the spine. And those can get sprained as well, just like you could sprain your ankle. But again, them alone is not usually the only source of pain. And then to the right, we have all the muscles. So you can see there's kind of a big structure of muscles in the lower back. If you see that kind of white material, that's called the fascia. And fascia has been getting a little bit more popular lately in terms of like, if anyone's ever heard of like myofascial release and different treatment techniques, basically the fascia is like a connective tissue as well. And it kind of connects everything in the body. So it can be a pretty important structure, but up until recently, people didn't really know exactly what it kind of functioned for. But it does have some pain receptors, so you can get some issues with pain in the fascia. And then you've got deep stabilizing muscles. So if you see that picture to the right, that's kind of like a zoomed in version of the spine, you can see these tiny little muscles that kind of like run at an angle. And those are those deep stabilizer muscles. And those ones in research over and over, they've proven that they kind of shut down when people have chronic pain. So these are muscles that we sort of have to like really work on getting the brain to connect with again, because they can be a big source of issue in the back as well.
All right, thanks, Dr. Jessie. So basically, well, actually, I'll let her finish this slide too.
Can you guys hear me?
Yeah, now I can.
Okay, so when everybody always wants to know where the pain comes from, right? So it's hard to know exactly where. Again, like we said, you can't really pinpoint a specific structure that's causing the pain. Some of the research suggests that the disc itself causes some pain in like the localized pain that you get in the back. And then the nerve root, like I said before, can be the source of pain for sciatica. But like Carrie's gonna talk about, it's really not, it's not like I'm having pain in my back, it must be my disc. There are a lot of other little components. So although it'd be nice for us to be able to say, oh, that's definitely it, usually it's kind of a little bit more vague. But it can be a good thing, because that means that, you know, if you find out you have a problem in your back, there's usually a lot of treatments that you can still do for it without kind of going for a surgical procedure. So,
yeah. All right, awesome. Thank you. So, okay, so we talked a little bit about why back pain is such a big problem, and then how it can come from a lot of different places. And Dr. Jessie just went over a whole bunch of places where that pain can come from. Come from nerves, it can come from muscles, it can come from the disc, from the joints, and all of that. So how the heck do you figure it out, and what is the best next step? So now, MRIs are not the next best step, but I would need to talk about them because they're a common next step. So here's the thing. So typically, people who have back problems, the normal course of treatment, if you will, is someone, you know, you have pain in your back, and a lot of times it can be pretty severe, and it can be very scary. So the natural thing is to go to the doctor, maybe even a specialist. You might go right to an orthopedic surgeon or a neurosurgeon to see what's going on in your back. And the way medical doctors typically figure things out is through pictures. They'll take x-rays, they'll take MRIs, because, you know, they want to make sure there isn't anything like really serious. And back to what we said earlier, when we say serious or sinister, think broken bones, some kind of, you know, abnormal growth or something, or an inflammatory condition. But the thing is, and we'll talk about this in a minute, I wanted to start with this so you'd understand, but there's usually telltale signs that will indicate that you might have something sinister, and it has to do with things like constant unrelenting pain, or things just don't add up, and that's a reason to definitely go get an MRI. But what happens is we get MRIs when they're not always necessary, And while they're a great tool to see everything and it's good to know what's going on, it can also lead to inaccurate associations, because just because you see something over here on the MRI, this MRI is showing some bulging discs, some herniated discs, doesn't mean that is the reason for your pain. Because what the research shows is that 65 out of 100 adults, so like 60 to 70% of people without back pain will have these problems. So what that means is you can have someone over here with the exact same MRI and have no problems at all. Then you can have someone over here with the exact same MRI, same looking spine, and have terrible pain. They don't correlate, and the research shows this over and over and over and over. So you might think to yourself, well, why is that a big deal? I'd rather know what's going on. Well, it's a big deal because it can alter the course of your treatment. So if you're in terrible pain and it shows that you've got this herniated disc, you might, the medical professional might be more inclined to send you more quickly to the OR or give you injections. And with that, now things like surgery and things like an injection are really good, as long as you don't have any complications from them, are really good at taking away your pain. They are. I mean, they take away the pain faster than we probably can. The problem is they don't get to the source. They only impact what's going on here. And what happens is these things do irritate the structures around them. We'll talk about that in a minute. They do irritate the nerves, but the reason that they got there is the root cause. And that's where we get into like lifestyle factors and things like that. So it's really important. You can't ignore one and not the other. You have to address both. That's a big, big missing piece with back pain treatment in general, and why it affects so many people and why it costs so much money. So I kind of answered this question, but if you don't need an MRI, what can you do? Well, basically, you've got to figure out what's going on musculoskeletally, and if the mechanical pain is how much of the mechanical pain and what's going on. So the good news is that 70 to 80% of all musculoskeletal pain, not just back pain, is what we call mechanical. And if it's mechanical, that is good, okay? Because you can fix it without pills, without procedures, without surgery. Mechanical pain is fixed with movement, which is what we specialize in, which is why we love working with this so much. So that's the good news. So let's talk a little bit about what mechanical pain is and how do you know if you have it. So mechanical pain, some of the telltale signs are this. So pain comes and goes, you have good days and bad days. So what that looks like is, you know, a lot of you on here and a lot of clients that we work with have had back pain for years. The reason they have it for years is because this particular piece doesn't get fully addressed. So what'll happen is, you know, you'll get an episode, or you'll kind of throw out your back. You'll have really bad back pain, and it'll kill for a couple of days. But then, just with normal everyday movement, it will start to get a little better. And then you'll think, oh, I think I'm good. And then you'll start exercising. And exercise always makes things feel better generally, because it gets blood flow going. You've got endorphins, all of that stuff, and movement and exercise is generally good. And that'll last you a little while, and then until one day, boom, it comes back again. That is classic mechanical pain. It comes and goes, good days and bad days. And those good days and bad days can be over the course of years even. It'll often come out of nowhere. This is the kind of pain that, like, one day you'll be fine, and then you'll wake up the next morning and be like, oh my God, what did I do? Like, why is my back hurting me? The best way to figure out mechanical pain is with movement, because that's where things are either going a little wrong, or there might be something that you yourself, it's not obvious to you, but to someone like us who we're movement experts, we know how to detect for these things and figure out if there's something underlying there and why the problems keep happening. The other distinction here, I mentioned pain comes and goes, good days and bad days. Back to the MRIs and the x-rays, a lot of times, you know, you may have gone to the doctor and they told you had something like stenosis or arthritis. Well, those conditions are degenerative. They happen over time. By the way, they're normal. It happens to everybody as you age. So clearly, if you're in your 50s and 60s and you go get an x-ray, some form of that's going to show up. It's normal. The thing about those conditions is they don't come and go. So it's impossible for that to be the only reason for your pain. It can contribute, but it can't be the only reason for your pain if the pain comes and goes and you have good days and bad days, because those conditions don't come and go. So that's a big distinction that sometimes it's hard for people to understand. It isn't always talked about, but it's important to talk about it. So back to these structures a little bit. So Dr. Jesse mentioned a big culprit for back pain is the disc. okay? And this is why, and we'll get into this in a second, but basically, mechanical pain I mentioned can come and go, okay? So what happens is, this is a normal disc. You've got this nice strong annulus around the jelly-like substance. But then over time, just like I mentioned with arthritis, you get wear and tear as you go. You also get these little micro tears in your disc. And these things just happen. They happen with, which we'll get into in a second, maybe not perfectly balanced movement patterns, abnormal movement patterns. So as you get these little tears in the disc, it just makes it easier for this kind of jelly-like substance to kind of push out a little bit. So this is kind of what happens when you have a bulge, and this is what happens when you have a herniation. So, and these are just pictures, by the way. There's a lot of like nuances to this stuff in real life, but this is just to kind of give you an idea of what's happening in the body. So when you've just got a bulge, it can certainly be annoying, but as you can see, you may not notice anything at all because it may or may not irritate these structures. If you've got a herniation, it's more likely that you're getting this nerve really angry, or it could even be pinched, and that's when you'll start to get stuff kind of down your leg and things like that. So the reason why that's important is because we mentioned mechanical pain comes and goes as related to movement. So how can something like this come and go, okay? So basically, when we move, okay, those discs, the main reason for them is to absorb shock. Just like the curves in the spine help to absorb shock, the discs are meant to absorb shock. And that jelly-like substance is supposed to move around. So what happens when you bend forward is that, like, this would be kind of like bending forward. You open up the space in your back. So a lot of times stretching forward like feels really good. It stretches you out. It kind of opens up that space. And what it does is it kind of squishes that jelly a little bit, like if you're squishing a donut, and it moves backwards. So back to this picture, that would be like doing this. And especially if you've got weakness over here, it makes it, this is normal, but it's not normal if it stays there. You don't want to like it to stay there. So, and then if you bend backwards, it does the opposite. The disc will move, the disc contents will move this way, okay? So the reason why that's important is because lifestyle factors contribute to this. So basically, this is what we do a lot more than bending backwards. The average person, and this is true, it's been studied, the average person bends or flexes forward, like all these people in the picture, 3,000 to 5,000 times a day. That's it. It's not a big deal when you're young, or when you're not in your 40s, 50s, or 60s, but it does become a big deal if you've been doing this over the course. If you bend 3,000 to 5,000 times a day over the course of 30, 40, 50 years, it eventually becomes a problem, because back to this slide, it's going to start to create uneven forces, and then this disc might not move back. It might kind of stay hanging out there, and that's when you start to have problems. So that's a big reason for people having back pain. So back to what we said about the MRI, that's why someone over here could have bulging discs, which they happen anyway. Because if we're bending 3,000 to 5,000 times a day just due to our modern lifestyles, it's just going to be really hard for that not to happen. But if you're doing other good things for your spine to counteract that, it really could never be a problem for you. But then if you've got someone over here with the same problem who just doesn't balance out and doesn't have the mobility to balance out, then their disc is going to be a lot more of an issue, because it's there more of the time. So that's kind of why it gets so confusing, why you can't just rely on MRI to decide how you're going to help your back pain. So, let's talk about posture for a second. So obviously posture, in addition to just moving, is gonna influence this stuff. So if you have a sitting job, and if you're home right now sitting a lot more than you normally would, that's gonna do the same thing as bending forward all the time. But the thing is, so you got this little guy down here, he can bend and all that, and it's not as big a deal. He's like 6 years old, and he hasn't been bending 3,000 to 5,000 times a day yet, and he certainly hasn't been doing it for 30 or 40 years. So it's not a problem yet. It becomes a problem as you get older. That's why back pain oftentimes doesn't show up until you're in your 40s, because these things happen slowly over time. So it's so important to talk about good postural habits. That's why things like yoga and Pilates are so good for you, because they're balanced activities that keep your body moving in lots of directions. But sometimes you need more than that. So that's what we're going to talk about a lot. And then the other thing that can happen, I'll go back to the slide for a second. The other thing that can happen aside from the disc is that if you have poor posture, so you can sustain like not great posture some of the time. But if you do it all the time, the other thing that can happen is, if you look at this slide, those muscles in your back can get what's called creep. So what that means is if you've been sitting for many years, all the time, those muscles can actually, like especially all these little guys in here, those muscles can get stretched out over time. And when that happens, they lose their elasticity and they lose like nutrition and like nutrition content. So what that means is that they actually effectively get weaker. So that's why sometimes you can sneeze or move the wrong way and bam, that muscle will just, it kind of gives out on you because it doesn't have as much strength as a normal, elastic, healthy muscle. So that's why sitting posture all the time is not good. Anything in, we always say in moderation, right? If you do something all the time, including with our bodies, it's going to be a problem. So inactivity, sitting too much, not moving around is just not good for anything, definitely not your back. It leads to joint stiffness, it leads to reduced flexibility, and it definitely contributes to low back pain. So, all right, so great. You guys probably knew a lot of this already. What the heck to do? So remember we said mechanical pain can be treated naturally. So that's essentially what we focus on and what we do in our office. So we kind of have 3 stages we take people through. So, and this is where things get confusing. It's really important to understand this. So, all right, you're here on this topic, you're here on this webinar right now. You're like, wow, this makes a lot of sense. I sit all the time. I bend too much. My job, I drive, I sit. Now I'm sitting even more. It makes sense that my back hurts, and that's what happens to most people. And then maybe you've been told you have a bulging disc. Now it makes even more sense. So the natural thing would be to improve your posture and start moving. But depending on how long you've had it, for some of you, that advice is going to work and you're going to feel better. But for some of you, it's not quite so simple because, as we said, inactivity leads to stiffness and immobility. So you may need some help getting your spine to where it needs to go. So that's what we always work on first. We check your mobility first, make sure that you're moving the way you're supposed to. Then we address things like your posture, and then we want to maintain it. And that's where we use Pilates in our practice quite a bit. These guys are using our springs, and that's kind of what we do in our group classes. But the great thing about Pilates is you can do it at home. Our whole entire practice had to shift to virtual almost immediately as soon as the COVID-19 stuff started happening. So, all of our clients, our Pilates clients aren't coming in right now, but they're all still doing it. They're doing it from home, and it's been awesome. So one of the things we do a lot is we encourage people to bend backwards because I mentioned, a lot of the problems come from bending forward too much and sitting. Even though everyone comes in, everybody says, oh, it feels, I'm like, what helps your back? Oh, it feels so good when I stretch forward. And then we tell them kind of not to do it for a little while, and they don't understand. Well, here's a little trick for you is if you do a certain stretch, all stretching, just about all movement helps. But if you do something and it helps for like a half hour or an hour, or maybe even the afternoon, but then the next day or a little bit later, the pain all comes back again, it didn't really help you, okay? What counts is when it helps and then it stays helping, okay? And that's a distinguishing thing that it kind of makes sense, but it doesn't always make sense to you at first. So you got to be careful with movement. It can be deceiving. But one thing we know is that a lot of people do respond to this because of what we talked about earlier with the discs. I thought we went through all that with the discs and the bending forward. A lot of times your spine just needs to bend backwards. However, depending on how long you've had pain, for some of you, you start doing this, your back's going to feel better immediately. For some of you, your back might actually feel worse, which is definitely a reason to stop doing it. And you want to call someone like us and let us know. But what happens is your back might not be ready for it yet. So sometimes you've got to ease into it. And that's where, professionals like us come in. We know you need to be able to do it. You just might need help getting there. But this is one thing that we recommend to a lot of people. Can always test it yourself, but if something hurts and it keeps hurting, there's something else that needs to be looked at. But if it's hurting a little bit, but then it starts to feel better and it stays better, remember, it has to stay better for it to count, then you're on the right track. So, all of us are at different phases, but generally, if you've had back pain for a while and it's come and gone over the years, usually you need a little bit of expert help to kind of address that fully. The other thing that we work on, of course, is posture. So right behind me here. We always have our clients get these in our office. These are called lumbar rolls. But what it does, it's so great because it helps to maintain those natural curves that Jesse talked about earlier, which not only helps back pain, but it can help neck pain too. So again, it's not a license to sit all day, but these things are great when you do have an hour-long commute or something like that, or you have to go on a long plane ride and you know you can't get up and interrupt your sitting. These lumbar rolls really help to keep the natural curves in your spine. So we love using those. It's just the kind of a cheat to help you sit. There's a big myth. We talked about, we would clear up myths. Obviously, we specialize in Pilates. We really help people with core strengthening. Well, a lot of people think they need a strong core to be able to sit up straight. That's not true. The strength of your core has nothing to do with how well or how not well you can sit. Sitting is just not great for you anyway. We're not designed to do it. So if you do have to sit, it's best to use something like this to support you and have supported sitting so that you don't have to stress out your muscles so much. And then definitely you want to move. So moving is definitely medicine. We love walking. It's a natural activity. I mentioned sitting. One of the first things we say to people is don't sit longer than 30 minutes. If there's one thing that you're going to walk away with today, let it be this. If you have back pain right now, or even just stiffness, and you make this one simple change, I guarantee that your back's going to start to feel a little bit better. You got to interrupt your sitting every 30 minutes or so, because it's not the sitting itself, it's not the bad posture itself, it's the accumulation of things over time. So like I said, depending on where you are in your journey or in your spectrum, you may be able to, some of these quick tips will be all you need, but for some of you, you're going to need more. And then we love, standing desks at work are great. I talked to a woman this morning. One of the concerns she had was that at work, she's luckily still working, so she's happy about that. She's working from home. But one of the concerns she had was she doesn't have her standing desk. At work, she's got a standing desk so she can stand and sit frequently throughout the day. She's home now, like at a kitchen table and a wooden chair. And it's only been a couple of weeks and she's already starting to feel more back stiffness. So she's actually going to come in next week to get a little check-in and tune up and make sure that everything's going okay. And the other nice thing is we've been doing a lot of virtual sessions. So we can also do a virtual session with her and just look at how she's sitting and give her some tips for home. But those are definitely some easy tips that you can do right away to start helping your back. And then of course we love core strengthening. So your core isn't just your abs, it's your back muscles, it's your butt, it's your pelvic floor, it's kind of your whole trunk there. But those muscles are definitely important to help with back pain because you want to have good strength. So basically the function of exercise is definitely in prevention. So once you've fixed up your mobility, once we've taught you how to maintain it, and you've got your full mobility back, things don't hurt anymore, you're actually able to, you should be able to slouch without your back hurting right away. If you can't do that, that's a sign that things are kind of aggravated and not happy back there. So once all those things are good, you're still not done. And that's where a lot of kind of traditional, like physical therapy and traditional treatments fail you. You need to maintain it. So a lot of our clients work with us like a year or more because we might not see you all the time, but we'll see you every month or every 6 weeks to make sure that these things are staying there. And core strengthening is a huge part of that. And we in our practice love to use Pilates to do that. So a lot of our clients come in, we help them with their back, and then they stick around and they use our Pilates program to stay better. So kind of what I just said, this is kind of what we do. Our sort of MO, if you will, is check out your joints, see if you've got a mechanical problem. The chances are you do because 70 to 80% of the time it is a mechanical problem. We check your spine. Your spine, the joints in your spine, we mentioned bending forward. They work like a hinge joint, just like how I'm moving my elbow here. It should bend all the way. It should straighten all the way. It should bend and it should extend all the way without any problems. If anything is either stiff or hurting, you've got a mechanical issue. And we need to restore that first. We don't want to strengthen a system that isn't moving the right way. And then we want to get your posture going. A lot of times you can't even have good posture. We have so many people come in that say, I know I need good posture, but it hurts. Well, you may need some help restoring your mobility a little bit more so that you can even sustain that good posture. Then we want to optimize it. One of the reasons we use Pilates in our practice is because a lot of people have trouble. So we get you all feeling better, everything's feeling good, Well, sometimes because depending on how long you've had problems, your core might not be turned on, if you will. Your brain might have a hard time connecting. So that's where we start to optimize and improve everything. And then we want to maintain it all, so that you have lifelong relief versus just short-term fixes and things like that. So to summarize, we went through a lot. We definitely will answer some questions at the end. I'm seeing some activity in the chat, so hopefully you guys are getting some questions answered now. But basically, back pain is a big problem. It affects about 80% of the population, 4 out of 5 people. The discs and the nerve roots are thought to be the biggest contributors. Like what we talked about, bulging discs, things like that, herniated discs. Sometimes they can pinch on the nerve and cause pain to go down your leg. That might be the thing that gives you the pain, but it's usually influenced by things like poor posture, poor habits, bending too much, not extending enough. So that leads to mechanical pain and mechanical changes such as, decreased mobility over time. And then you need some help and you need real structured kind of a prescription for your movement to get all those things back. But ultimately, the movement is the best medicine for a couple of reasons. It's the safest. You really don't have any side effects from movement if you do it right and it's prescribed correctly. And it's something you can do forever. Our clients come in, they learn their prescription, they understand what they need for the correction, and it's something that they can use over and over again. So, they might not see us for a year or two and their back might start to act up again, and they know what to do. They've got a movement that they can get to right away before it becomes a big problem. That's why we love using movement as our medicine. And then to figure out which movement, and we mentioned, generally speaking, a lot of people do respond to that backward movement, but not everybody. Sometimes you need a little tweak to your movement. Sometimes you need something different. I mean, the only way to figure that out is with a movement assessment, but we figure that out and help you figure that out and ultimately work with you, which is why right now we've been able to still help so many people, because we don't always have to have our hands on you. That's not what we want to get our hands off of you and get you doing this on your own. So we've been able to help a lot of people from the comfort of their own home virtually quite easily, since that is our main prescription and medicine. So if this is resonating with you and you do feel like you want to talk to us and you want some extra help, or you want to just make sure what you're doing is right, or you're not even sure if you have a mechanical problem and you want to find out, you can definitely talk to us. Like I said, Jesse and I are opening up our schedule tomorrow for extra appointments. So just type in the chat right now, just say, call me. Michelle can call you right now and get you set up, or she'll put our phone number and our email in the chat as well. And you can reach out to us. You guys will get this replay tomorrow. But yeah, I mean, we're here to help, especially right now. Even if you just have a question, you're not sure what to do, you just want to make sure you're on the right track, definitely let us know. We're happy to help. All right, well, I hope you enjoyed the webinar. We went over a lot of information. Hopefully you took away something valuable, whether it be how to prevent back pain and sciatica or how to ease some of it on your own at home. But either way, I know that you might also have additional questions. So if you do, and we didn't get a chance to answer them in today's presentation, please reach out. We've opened up extra spots on our schedule for this next week just to answer people's questions, because we know there's going to be a lot after watching something like this. You can hop on the phone with either myself or my other specialist, Dr. Jesse, you met on the presentation, and we can help you answer any questions that you have. If you're looking for some help with your back pain or sciatica, what we do for a lot of people is we, help you figure out where you should go to get help. A lot of people that reach out to us are facing, surgery or the idea of an injection or some kind of procedure that they really don't want, because they feel like they've already exhausted all their options. So if you're looking for a second opinion, or you're trying to figure out if that is truly the best option for you, even though it's something that you don't want, we can help you. Just hop on the phone with us. Again, we can be reached at 603-380-7902, or you can email us at info@cjphysicaltherapy.com to get in touch. And, it's totally complimentary just to hop on the phone and talk with us and get your questions answered. So in the meantime, please let your friends and family know about us, and you can share this with them. If they have questions, we're happy to talk to them as well. Just let us know that you sent them, and hope you guys have a great rest of your day.